as she said earlier, she's a little nervous about the shot, so I'm going to just take the end of the Accupal. We're just going to rub it along the gum line. It kind of feels like a electric toothbrush, doesn't it? And what the vibration is doing right now is kind of tricking your nervous system into thinking that, like when you get a bee sting, you know how you scratch your skin? We're kind of scratching the skin before, during, and after that same bee sting. Okay? And the proper way to do this is my proven method, is I like to get the patient's cheek way up high, and then, as you can tell, the injection is going to be parallel with the actual root of the tooth. I like to hold it up close where we put the Accupal vibration, and look at her eyes. You can hardly tell anything. I usually like to look at their eyebrows to tell if they're feeling it with the needle. You can see how the anesthetic is pooled in there, and we're going to just kind of massage it in a little bit. Now, tell the truth. You don't have to. You don't have to lie or exaggerate.
No, that was perfect.
Didn't that feel good?
It did.
Speak up.
It felt good.
Okay. And that shot's normally, you know, you feel this. What do you typically feel with in shots in the past?
Oh, it was just, it's so deep. It felt like it was against the bone.
Yeah. Well, we're going to numb also the inside of the tooth.
Okay.
We're going to do the same thing, okay? And Penny is going to suction at the same time so that none of the medicine gets in your throat. You're going to turn this way for me. Now, if you notice the way I'm holding the unit now, is that we're going to press it flush against her palate. Then put your suction behind the area where I'm going to numb. Good. And there, I'm just gently putting it against the tissue. And you'll feel kind of like a little pressure there. That's the medicine going in. So look at her eyebrows again. She's doing super. You see, we are really in the tissue. We're not faking it. Deposit about, 2 or 3 millimeters of the plunger going through. You pull it out. If you open the wide one, if you notice, there's like a little round hole. You'll see a little red dot. That's where the actual shot went in. What do you think?
It's perfect.
Isn't that amazing?
That is amazing.
Well, you know that a tooth on the palate is so painful. And what do you think about the vibration? Did it help it quite a bit?
Yes, it did.
How about on a scale of 10 being childbirth?
10.
Oh, 0 then. But yeah.
It was great.
Good. Listen, we're going to let that numb up for 4 or 5 minutes.
Okay.
Get in there really good.
That was great. I mean, that was 0. I didn't
You
know
promise?
10. I promise.
Good. Good. Well, I appreciate you letting us
my
tape
goodness.
it, because what I'm doing is I'm teaching other dentists so
Okay.
that their patients will find it a lot easier.
That's great.